Mucormycosis or black fungus. Hello Dr. Sham, how are you? I am Raj, a news anchor, and I worked for one of the famous news channel in India, and came here to meet you and wanted to collect some useful information regarding recent days' major talk about one of the disease after COVID-19. I hope you already understood, regarding which I am going to ask questions. Yes, it is about black fungus or mucormycosis.
Hello Raj, I am fine and thank you. Hope you are doing good. Of course, we can talk about that, as nowadays many people are scared about the same in India, and it is good that you are trying to put some awareness regarding the misunderstandings about the same. I am happy that you are doing some groundwork on the same, and trying to help public to understand it better.
Thank you, doctor. Even in your busy schedule, you agreed for my interview on this topic. Alright, let's start then. I will start with basic question, which will explain our viewers regarding the disease and its effects and recovery details. And also how can we take precautions to less exposure to this disease. Let me start with this. What is mucormycosis, or black fungus?
Mucormycosis is a very rare infection. It is caused by exposure to mucar mold, which is commonly found in soil, plants, manure, and decaying fruits and vegetables. It is ubiquitous and found in soil and air and even in the nose and mucus of healthy people.
Okay, fine, but how it is affecting, and who all are getting affected with this?
It affects the sinuses, the brain, and the lungs, and can be life-threatening in diabetic or severely immunocompromised individuals, such as cancer patients or people with HIV/AIDS.
Thank you, doctor, but how people are getting it, and who are getting infected with this disease?
Well, we doctors believe mucormycosis, which has an overall mortality rate of 50%, may be being triggered by the use of steroids, a life-saving treatment for severe and critically ill COVID-19 patients. Steroids reduce inflammation in the lungs for COVID-19 and appear to help stop some of the damage that can happen when the body's immune system goes into overdrive to fight off coronavirus. But they also reduce immunity and push up blood sugar levels in both diabetics and non-diabetic COVID-19 patients.
So you mean the COVID-recovered patients are the one who getting infected with this disease?
Yes, right now it is the truth. It's thought that this drop in immunity could be triggering these cases of mucormycosis. Diabetes lowers the body's immune defenses, coronavirus exacerbates it, and then steroids, which help fight COVID-19, act like fuel to the fire. Dr. Nair, who works in 3 hospitals in Mumbai, one of the worst hit cities in the second wave, says he has already seen some 40 patients suffering from the fungal infection in April. Many of them were diabetics who had recovered from COVID-19 at home. 11 of them had to have an eye surgically removed. Between December and February, just 6 of his colleagues in 5 cities, Mumbai, Bangalore, Hyderabad, Delhi and Pune, reported 58 cases of the infection. Most of the patients contracted it between 12 to 15 days after recovery from COVID-19. Mumbai's busy Sion hospital has reported 24 cases of the fungal infection in the past 2 months, up from 6 cases a year, according to Dr. Renuka Bradu, head of the hospital's ear, nose and throat wing. 11 of them had to lose an eye, and 6 of them died. Most of her patients are middle-aged diabetics who were struck down by the fungus 2 weeks after recovering from COVID-19. We are already seeing 2 to 3 cases a week here. It's a nightmare inside a pandemic, she told me. In the southern city of Bangalore, Dr. Raghuraj Hegde, an eye surgeon, tells a similar story. He has seen 19 cases of mucormycosis in the past 2 weeks, most of them young patients. Some were so sick that we couldn't even operate on them.
Many of the doctors said that they are surprised by the severity and the frequency of this fungal infection during the second wave, compared to some cases during the first wave last year. Is that true?
Yes, according to Dr. Nair, he has come across not more than 10 cases in Mumbai in the past 2 years. This year is something different. And in Bangalore, Dr. Hegde had never seen more than 1 or 2 cases a year in over a decade of practice.
What are the symptoms of this disease?
Patients suffering from the fungal infection typically have symptoms of stuffy and bleeding nose, swelling of and pain in the eye, drooping of eyelids, and blood, and finally, loss of vision. There could be black patches of skin around the nose. According to some doctors, most of their patients arrive late when they are already losing vision, and doctors have to surgically remove the eye to stop the infection from reaching the brain. In some cases, doctors in India say patients have lost their vision in both eyes. And in rare cases, doctors have to surgically remove the jaw bone in order to stop the disease from spreading.
Is there any treatments which can help to avoid the spread of this disease to other parts like eye, nose and mouth?
Yes, an antifungal intravenous injection which costs 3,500 rupees $48 a dose, and has to be administered every day for up to 8 weeks, is the only drug effective against the disease. Amphotericin B or Ampho-B is an antifungal intravenous injection, which has to be administered every day for up to 8 weeks, to patients diagnosed with mucormycosis. And also in early treatment will also help to avoid or stop major damage, or spreading to other parts like nose, brain, and other areas which will become life-threatening if we delay the treatment.
This is the only injection we have? Or any other medicines available?
There are 2 forms of the drug available: standard amphotericin B deoxychelate and liposomal amphotericin. One way to stall the possibility of the fungal infection was to make sure that COVID-19 patients, both in treatment and after recovery, were being administered the right dose and duration of steroids. According to Mumbai-based diabetologist, he treated some 800 diabetic COVID-19 patients in the past year, and none of them contracted the fungal infection. He says, doctors should take care of the sugar levels after the patients are discharged. A senior government official says, there is no big outbreak. Yet it is difficult to say why a growing number of cases of mucormycosis are being reported from all over the country. The strain of the virus appears to be virulent, sending blood sugars soaring to very high levels. And according to Dr. Hegde in Bangalore, strangely, the fungal infection is affecting a lot of young people. His youngest patient last month was a 27-year-old man, who was not even a diabetic. Dr. Hegde says that, we had to operate on him during his second week of COVID-19 and remove his eye. It's pretty devastating. The western states of Gujarat and Maharashtra have reported more than half of the reported cases. At least 15 more states have reported between 8 and 900 cases. Following the rise in cases, India's 29 states have been told to declare this disease an epidemic. The black fungus infection has now become more challenging than COVID-19. If patients are not treated in time and properly, then the mortality rate can go up to 94%. The cost of treatment is expensive, and the drugs are also in short supply. The majority of the patients had recovered from COVID-19 and were male. Most of them had been treated with steroids, and all had underlying conditions of black fungus, mainly diabetes, and this is very bad.
Yes, doctor, it is very true. Few days back, even I read in one of the online news channel that a separate study by 4 Indian doctors has looked at more than 100 cases of COVID-19 patients who had contracted mucormycosis. It found 79 of them were men, and 83 of them suffered from diabetes.
Yes, you are right. Another study of 45 black fungus patients in 2 Mumbai hospitals found that all were diabetics or diagnosed with diabetes on admission. They all had very steep blood sugar levels. No patient of mucormycosis has normal blood sugar.
Thanks a lot, doctor, for your detailed answers over this another deadly disease. Hope this will help our viewers. Thanks for your time on this topic. We are almost at the end of this conversation. So, what you would like to tell to the public during this crucial time?
You are welcome, Raj. Nothing much to the public, as they already know the situation, and also the details about the disease, through some sources already. The only thing I advise them is, don't be panic, follow all guidelines from government, maintain social distance, use masks, don't be careless about your health, avoid all unnecessary travels out of your home. Maintain healthy activities, be positive and stay strong, take care of yourself and others as well. If possible, try to help others who are in trouble with respect to anything. Eat healthy and stay healthy. Thank you.
Thank you, doctor. I will end this conversation here. Hi all, thoughts it's about black fungus. Thanks for watching, and stay tuned for more updates. And if you like the video, please like, share, and subscribe my channel for similar updates. Thank you. Bye bye, take care, and see you next time.